Thanks, Bob. Well, this is the time of year a lot of us thinking about New Year's resolutions, and a lot of people say they want to exercise more.
Yes, I am one of those people. And today, Dr. Katherine Fox, a sports medicine physician with SSM Health, is here to talk about what you should consider before hitting the gym. Thank you so much for being here.
Thanks for having me, yes.
Everyone's talking about this right now. If you're about to jump back into exercising, what should people think about?
Yeah, great point. Let's start with, you want to think about your current health status. So what medical conditions do you have and what are you at risk for? Individuals who are at risk for heart disease, they should really check in with their doctor. So these are individuals who have high cholesterol, high blood pressure, diabetes, as well as over the age of 50 or just a family history of heart disease. You may need a stress test before you start vigorous exercise, so it's important to check in with your healthcare provider.
Yeah, if someone's like recovering from an injury, they've been injured in the past, is there anything else they need to consider too?
Yeah, so in general, I'd say we definitely want to like start slow and kind of ramp things up. If you have recently been injured, I would definitely modify your activity, check in with your healthcare professional if you're having persistent symptoms. Remember, just don't do anything too quickly. Increase the amount of time or the intensity of your exercise by about 10% per week.
So we all know about going to the gym. I was there this morning. A lot of people there this time of year. How can we all move more and sit less when we're at work and at home?
Yeah, this is something that I really try to emphasize to my patients. So we know that the more you sit, it associates with lower energy levels and just poor health status. So throughout the day, you want to try to be standing as much as possible. So intermittently using a standing desk, trying to take walking breaks at work, getting in like little brief 5 minutes. You know, if you can walk 5 or 10 minutes in the morning and 5 or 10 minutes at the end of the day, that is still better than doing nothing. So you don't have to commit to 60 minutes, just little bits of movements throughout the day.
Get the blood flowing a little bit.
Exactly.
Yeah, definitely some advice I could take. I sit at my desk too much.
I think we all do.
So a lot of people, motivation is a big thing for these resolutions. It might be easy to go to the gym this week. How do people keep up that motivation throughout the month and throughout the year?
Yeah, this is so important. So we want to have like small attainable goals. You know, we're not going to change our whole life overnight. So think about those little bits of working out. Also find something you can do that's fun and get some buddies to work out with. Even if it's not every time you work out, maybe some of the times you work out. Something else that I think is really important, you're not too tired to work out. Because you are tired, you need to get moving. It will give you more energy. So when you're like contemplating that afternoon Starbucks, maybe think, I should just go take a walk.
Good idea. And really quickly, you talked a little bit about this, the vigorousness of your activity. You know, where should we start? Some of us want to just jump right back into it and go full throttle, but what's your recommendation?
Yeah, so for those of us without the risk factors for heart disease, you know, starting off at like some moderate intensity exercise, such as like brisker walking, jogging, running, that's great. If you do have those risk factors I mentioned before, low intensity exercise, totally fine. Lighter walking, stretching, yoga. But just remember, like whatever you're doing, like don't increase the intensity too quickly from where you were working out previously.
All right, a lot of really good information. Thank you so much for being here with us today,
Thanks
Dr.
for having
Fox.
me.
Yes.